Okay, let's see question number 8. Okay, here students, question number 8 will say which of the following IV induction agents. Okay, IV anesthetic induction agent is a drug of choice for a daycare surgery. Okay, so daycare surgery. Okay, so for daycare surgery, which of the following is a drug of choice for IV induction? Okay, so which of the following IV induction agent is a drug of choice for daycare surgery? Option A is a ketamine, option B is thiopentol sodium, option C propofol, and option D is a etomidate. Okay, so what do you mean by daycare surgery? Daycare surgery means patient will admit to the hospital on the same day and he will undergo surgery, and on the same day patient will be discharged from the hospital. So that is known as a daycare surgery. Okay. So for the daycare surgery, which IV anesthetic agents, which IV anesthetic induction agent is suitable for daycare surgery, they have asked here. Okay. So option A is ketamine, option B is thiopentol sodium, option C propofol, option D is etomidate. Okay. Here propofol. Okay. So option C propofol is the right option here, as propofol has a rapid onset of action and patient will immediately recover from this anesthetic effect. So this propofol is a drug of choice for the daycare surgery. Okay, so propofol is having a rapid onset of action and patient will rapidly recover from a propofol effect. So that is the reason why propofol is a best IV induction agents for a daycare surgery. So option C propofol is the right option here. Ketamine and thiopentol sodium and etomidate are not used for a daycare surgery. Okay, dear students, let's see next question. Question number 9. Which of the following inhalational anesthetic agent is the least potent? Okay. Option A nitrous oxide, option B desflurane, option C sevoflurane, option D is methoxyflurane. Okay. So here, which of these which is having a least potent? Okay, they asked which is the least potent. Okay. So the potency of this inhalation agents depends upon the MAC value. Okay, what is that MAC value? That is minimum alveolar concentration. What is MAC value? That is a minimum alveolar concentration. Minimum alveolar concentration. So the inhalation agents which is having a high MAC value is the least potent. The inhalation agents which is having a low MAC value is a more potent, is the most potent. Okay, so we need to know what are the MAC value of all these agents. Okay, so then we will come to know whether it is a least potent or a most potent. Okay, so what is the MAC value of here? So let us see minimum alveolar concentration of all this. So MAC value. So MAC value of nitrous oxide. MAC value of nitrous oxide is a 105. Okay, MAC value of desflurane, it is a 6. MAC value of sevoflurane is 2, and MAC value of methoxyflurane is 0.16. Okay, so here the nitrous oxide is having a high MAC value. Okay, so high MAC value, that means it is a least potent. So already I have told you that the inhalation anesthetic agent which is having a high MAC value, high minimum alveolar concentration, is the least potent. Okay, and which of the following is having a least MAC value? It is a methoxyflurane is having only 0.16. It is a least MAC value and it is a high potent. It is a highest potent. Okay. So what happens here? Nitrous oxides. Okay. Large quantity of nitrous oxide is required to induce a state of anesthesia or to maintain the state of a anesthetic effect. Okay. So that is a MAC value. So why it is having a more MAC value here? It is because nitrous oxide require a high concentration of alveolar concentration of nitrous oxide is required to maintain the patient in the state of anesthesia. Okay, to maintain the patient in the state of anesthetic effect. Okay, whereas methoxyflurane is only 0.16. It is very less MAC value, less minimum alveolar concentration, very less quantity of methoxyflurane is required to maintain the patient in a anesthetic effect. Okay, so the methoxyflurane is having a MAC value of 0.16, which is a highest potent, and nitrous oxide which is having a MAC value of 105, it is a least potent. Okay, so desflurane and sevoflurane, they have a MAC value of 6 and 2. Okay, so the answer here, which of the following inhalant anesthetic agent is the least potent? Okay, so as nitrous oxide is having a high MAC value, it is the least potent. So option E is a correct answer here. Option B is okay. Option C as option D are wrong here. Option D, that is methoxyfluorine, is a not it is not a least potent, it is a highest potent. Okay, as it is having a low MAC value. Okay, dear students, let's see next question. Question number 10. Which of the following inhalational anesthetic agent is contraindicated in closed loop surgery? Okay, option A is halothin, option B is sevoflurane, option C nitrous oxide, option D is isoflurane. Okay, so what is this closed loop surgery? Okay, closed loop surgery like a passage surgery, like a ear passage. Okay, so here we are having a loop here. Okay, one passage is there. Okay, so when you do like a closed loop surgery, like example is tympanoplasty. Example I can say here. So example for closed loop surgery is tympanoplasty. Okay, tympanoplasty. Okay, so in case of closed loop surgery, like example tympanoplasty, which inhalation anesthetic agent is contraindicated? Okay, option A is halothin, option B is sevoflurane, option C is nitrous oxide, option D is isoflurane. Okay, so for all closed loop surgery, nitrous oxide is a contraindicated. It is contraindicated. Okay, so we should not use nitrous oxide for a closed loop surgery because nitrous oxide causes the expansion of a loop, expansion of air spaces. So that is the reason why it can damage the tympanic membrane. So that is the reason why in case of tympanoplasty, okay, so ear surgery, the nitrous oxide is switched off. Okay, nitrous oxide is not given in case of tympanoplasty. Okay, so as it causes the expansion of air space. Okay, which can lead to damage of a tympanic membrane. So that is the reason why for all closed loop surgery, nitrous oxide is a contraindicated. Okay, not only closed loop surgery, even it is also contraindicated in case of pregnancy. Okay, it is contraindicated in case of a pregnancy. So in case of pregnancy and a closed loop surgery, so this drug is a contraindicated. So nitrous oxide is contraindicated. So which are the following inhalation anesthetic agent is contraindicated in closed loop surgery? It is a nitrous oxide. Okay, whereas halothin, sevoflurane and isoflurane are not contraindicated. Here nitrous oxide is completely contraindicated for a closed loop surgery. Example is tympanoplasty. And it is, students, let's see next question. Question number 11. A surgery which is done below the level of umbilicus within 2 to 3 hours. Which type of anesthesia is given? Okay, see here a patient. Here is a patient here. Okay, so it is a patient abdomen and here is the umbilicus. Okay, so here a surgery is done. Okay, a surgery is done below the level of umbilicus. It is a below the level of umbilicus. This is the umbilicus here. Umbilicus. Okay, a surgery is done below the level of umbilicus. Below the level of umbilicus. Okay, and that surgery completes within 2 to 3 hours. Then which type of anesthesia is given for the such patients? Okay, so option E is a general anesthesia. So general anesthesia is not required here. Any surgery which is done below the level of umbilicus, okay, general anesthesia is not required here. Okay, because the anesthetic effect is required only at the below the level of umbilicus. So patient may not be needed to made a loss of consciousness. So general anesthesia is not required. When you want to induce anesthetic effect only below the level of umbilicus, general anesthesia is not required. Option B is the epidural anesthesia. Okay, so this epidural anesthesia we use when any surgery which is done below the level of umbilicus, which require time more than 3 hours. When the time required for prolongation, when we need a prolonged anesthetic effect below the level of umbilicus. Okay, for example orthopedic surgery which are done below the level of umbilicus and which will not complete within a 2 to 3 hours, which may require more than 3 hours. So for that reason, okay, in that condition we use a epidural anesthesia. Okay, and what is the spinal anesthesia? Okay, in spinal anesthesia, okay, any surgery below the level of umbilicus which will finishes within 2 to 3 hours, which completes within 2 to 3 hours, we will go for a spinal anesthesia. Okay, so the surgery which is done below the level of umbilicus, okay, within and which completes within 2 to 3 hours, okay, it is a spinal anesthesia choice. It is a choice, anesthesia choice for any surgery below the level of umbilicus which completes within 2 to 3 hours. It is a spinal anesthesia is a choice for okay, it can be. Okay, dear students, let's see next question. Question number 12. Most commonly used local anesthetic agents. Okay, option A bupivacaine, option B chlorprocaine, option C dibucaine, option D lignocaine. Okay, see here this bupivacaine, this is the most commonly used local anesthetic drug for spinal anesthesia. Okay, See, for to induce the patient either spinal anesthesia or epidural anesthesia, we use a local anesthetic drug only. Okay, we don't use a separate drug for a regional anesthesia. So regional anesthesia includes local anesthesia. Regional anesthesia includes spinal anesthesia and epidural anesthesia. Okay, for spinal anesthesia and epidural anesthesia, we use the same drug. Okay, local anesthetic agents only we use for a spinal anesthesia as well as epidural anesthesia. Okay, so this bupivacaine is a most commonly used local anesthetic agent for spinal anesthesia. Okay, it is the most commonly used local anesthetic drug for a spinal anesthesia. Okay, so it is not a most commonly used local anesthetic agents. Okay, it is the most commonly used local anesthetic agent for spinal anesthesia. Spinal anesthesia. Okay, so this is not right option here. Then chlorprocaine. Chlorprocaine is a shortest acting. It is a shortest acting local anesthetic agents. It is the shortest acting local anesthetic agents, but not commonly used for a local anesthesia. Okay, and dibucaine. This dibucaine is the longest acting. Dibucaine is a longest acting local anesthetic drug. It is the longest acting local anesthetic drug, but still it is not a commonly used local anesthetic agents. Then which one? It is a lignocaine. Okay, lignocaine is the one which is commonly used local anesthetic drugs. It is a most commonly. It is a commonly used local anesthetic agents. So whenever any surgery is to be done under local anesthesia, okay, so lignocaine is used. So lignocaine is the most commonly used local anesthetic agents worldwide. Okay, dear students, let's see next question. Question number 13. Which of the following is the most common complication? Which is the most common complication of spinal anesthesia? See, after giving spinal anesthesia, immediately after giving spinal anesthesia, what is the most common complications? Okay, they have asked here. Okay, so which of the following is the most common complication of spinal anesthesia? Okay, option A is a hypertension. Okay, see here, patient will not develop a hypertension after giving a spinal anesthesia. Instead, patient will develop a hypotension. Okay, so here option A is the wrong option here. Then option B, that is a high spinal anesthesia. Okay, so whenever you give a spinal anesthesia, okay, so it has to induce its anesthetic effect below the level of umbilicus. If the anesthetic effect is going above the level of umbilicus, okay, if it is going to the above level of umbilicus, so that is known as a high spinal effect. Okay, high spinal effect or high spinal anesthesia. So this high spinal anesthesia is also occurs, okay, after giving a spinal anesthesia in some cases when there is a overdoses of a spinal anesthetic drug, overdoses of a local anesthetic drug is being injected into the subarachnoid space. But it is not a most common complication of spinal anesthesia. It is not a most common complication of a spinal anesthesia. Okay. Next option C is the hypotension. See, hypotension is the most common complication. Hypotension is the most common complication of spinal anesthesia. Okay. So immediately after injecting a local anesthetic drug into the subarachnoid space, okay, then what happens here? Patient may develop a hypotension. Why patient will develop hypotension? Because there is a vasodilatation, peripheral vasodilatation occurs, and there will be decreased venous return. So that will decrease stroke volume, decrease cardiac output, decrease peripheral tissue perfusion, and decrease cardiac output. So because of decreased cardiac output, there is a decreased pressure on the wall of blood vessels by the blood. Okay. So most common complication of spinal anesthesia is a hypotension. Okay. So which is the most common complication of spinal anesthesia? It is a hypotension. Okay. So immediately after administration of a local anesthetic drug into the subarachnoid space, patient can develop a hypotension. Okay. And next one is option D, that is urinary retention. Okay. So this urinary retention is the most common complication of a spinal anesthesia after the surgery. Okay, post-operative. So which of the following is the most common complication of spinal anesthesia after surgery or post-operative? Okay. So post-operatively, the common complication of spinal anesthesia is urinary retention. Okay. So urinary retention is the most common post-operative complication of a spinal anesthesia. Okay, it is the most common. Okay, it is the most common. It is the most common post-operative. Okay, post-operative complication. Post-operative complication of spinal anesthesia. Okay, so when they ask which of the following is the most common post-operative complication of spinal anesthesia, it is urinary retention. If they ask simply which of the following is the most common complication of spinal anesthesia, it is a hypotension. So the answer for this one, which of the following is the most common complication of spinal anesthesia, it is a option C, that is a hypotension. Okay, dear students, let's see next question. Question number 14. most commonly used space for spinal anesthesia is, okay. So when we want to induce a spinal anesthesia effect, we have to, okay, prick the needle, okay. We have to prick the needle between the we have to prick the needle into the intervertebral space, okay, and then the tip of the needle should go into the subarachnoid space. Then after dribbling of a CSF, okay, through the needle, then only the local anesthetic drug, that is most commonly used local anesthetic drug, that is bupivacaine, is injected, okay. So this is a, if you take this is the back of the patient, okay. So here there will be vertebral body will be there, vertebral body will be there, okay, and then here will be there will be dura mater, arachnoid matter, and pia mater will be there. So here the needle has to prick it, okay, into the intervertebral space, okay. Then it has to prick the dura mater, then arachnoid matter, and then it has to come to the, what is that? That is space. Which space? That is arachnoid matter and pia mater. So this is known as subarachnoid space. It is known as subarachnoid space. Okay. So here once the tip of needle enter into this one, there is a dribbling of a CSF. So after confirmation of a tip of needle into the subarachnoid space, how it is confirmed? By dribbling of CSF. Then the local anesthetic drugs, that is most commonly used bupivacaine, is injected into the subarachnoid space. Okay. So they asked here most commonly used space for spinal anesthesia. When you want to use spinal anesthesia, where you prick the needle, okay. So the needle has to be pricked either, okay. First option is between L3 and L4. Option B is between L4 and L5. Option C is between T3 and T4. Option D is between L1 and L2. Okay. So L stand for here lumbar. Okay. Lumbar 3 and lumbar 4. Okay. Lumbar 4 and lumbar 5. Here 3 stand for thoracic. Thoracic 3 and thoracic 4. Lumbar 1 and lumbar 2. Okay. So option A is L3 and L4. So this L3 and L4, it is a second choice. Okay. It is always a second choice. Okay. Not most commonly used space. Okay. For the spinal anesthesia. Okay. So between L4, between lumbar 4 and lumbar 5 vertebral body, so it is the choice. It is the first choice. It is the most commonly used space for inducing spinal anesthesia. Okay, whereas T3 and T4 is the wrong option, and L1 and L2 is also wrong. Okay, so we will not insert a needle between T3 and T4 and between L1 and L2. Okay, so first we try to, okay, first most commonly used space for inducing spinal anesthesia is between lumbar 4 and lumbar 5. Okay, and second commonest space for inducing spinal anesthesia is between lumbar 3 and lumbar 4 vertebral body. Okay, so answer B, that is between lumbar 4 and lumbar spine 5 is a most commonly used space for a spinal anesthesia. Okay, dear students, let's see next question. Question number 15. Which of the following is a neuromuscular blocking agent? That is a neuromuscular blocking agents are also known as muscle relaxants, is having shortest onset of action. Okay, means which of the following is having a fastest acting, okay, fastest onset of action. Okay, which of the following these muscle relaxants, okay, or neuromuscular blocking agents is having a fastest onset of action. Okay, option is a mivacuronium, option B is a ecuronium, option C succinylcholine, and option D is a rapacuronium. Okay, so see here the muscle relaxants or neuromuscular blocking agents which is having a shortest onset of action, okay, fastest and shortest onset of action, it is nothing but a succinylcholine. Okay, so this succinylcholine is having it is a fastest and shortest, acting muscle relaxants. Okay, it is a, what is the succinylcholine? Succinylcholine is it is a fastest and a shortest acting muscle relaxant, or it is a fastest and a shortest acting neuromuscular blocking agents. Okay, so immediately after giving this medication, patient will have a relaxation of all skeletal muscles. Okay, immediately patient will have onset of action. Immediate onset of action will be there once you administer this succinylcholine. Okay, succinylcholine is also known as choline. Succinylcholine is also known as choline. Okay, it is also known as suxamethonium. Okay, or it is also known as succinylcholine. Okay, so all three names are same. Either we can call it as a succinylcholine or choline or a suxamethonium. Okay, so option A mecorium, okay, mivacorium. Option B, that is a vecuronium, and option D rapacuronium is a wrong option here. So the only neuromuscular blocking agents are muscle relaxants which is having a fastest and shortest onset of action is a succinylcholine, which is also known as scoline or a suxamethonium. Okay, so I guess all the questions which are discussed in anesthesia are very much helpful to you. So all of you go through these questions, okay, and read about anesthesia as well. Okay, so this is what about today's discussion. Thank you very much.